Thank
Just
you.
added
Hi,
another.
hi everybody, it's Diana DeGette.
Good
Is
morning.
now joining.
Good morning, Diana DeGette. It's Linda Olson. Welcome to our
Hi, Mayor.
virtual meeting.
I know. Thank you, guys. Do we have everybody or do we want to wait a few minutes?
I think it would be wise for everybody to just say their name and position so that we hear, because some of these are phone numbers and we're not sure who they're from. So this is
Okay.
Mayor Linda Olson, District 2.
Mayor, did you want to just go name by name down the list and see if they're on the line?
I would prefer
Okay.
that everybody, yeah. So if you say your name so that we can hear it, because there's
Unknown
phone numbers.
participant is now exiting.
All right.
Well, I
so
just meant if you called out Mayor Pro Tem and then called out each person, since we may be talking over each other. So.
okay, I'll do that then. All right, Mayor Pro Tem.
Good morning. This is Mayor Pro Tem Sierra.
Hi.
Good morning.
Member Cuesta.
Good morning, Dave Cuesta here.
Member Wink. Member Stone.
Hey, this is Councilmember John Stone.
Member Russell. And did I miss anybody? Member Anderson.
This is Councilmember Joe Anderson, District 3.
Then we have Manager Sean Lewis.
Hi, Sean Lewis, City Manager.
Our City Clerk.
Good morning, Stephanie Carlisle.
Our City Attorney.
Good morning, this is Allison McKinney Brown.
And the Manager's Executive Assistant. Krista.
Good morning, this is Krista Gravy.
And then I see some other numbers, so I don't know who they are.
Good morning,
Joe,
everyone. This
are
is
you
Joe.
on the line?
I
Who is
am
that?
Congresswoman.
It's Joe Middleton,
morning, everyone.
my District Director.
Okay, great. All
Good
right.
morning, thank you.
Anybody else? All right, Congresswoman, take it away. Make the world
Okay,
better.
thank you so much. Thanks, Mayor, and you guys, thank you so much for doing this as a telephone town hall meeting when it looked like the coronavirus demands were getting so great. We thought briefly about canceling or postponing the meeting, but then we thought actually with everything that's going on, it might be useful to just do a telephone conference, and we've been doing that. We're all of my staff and I, both Washington and in Denver, are working. We're self distancing as is recommended, and so we're all working from home, which has presented some of us with some very interesting technological challenges, but we're able to do it. Last night we had a telephone town hall meeting for the residents of the 1st Congressional District. We had over 9,000 people on the telephone last night talking to them about what's going on. And this morning we had over 250 messages on our voicemail. So you can rest assured that my staff's going to be keeping busy helping the residents figure out what they need to be doing and helping figure out what the economic needs are. And also, we have been in continuous contact, obviously, with the national health agencies, the CDC, the FDA, other agencies, trying to push them about testing and about safety and so on. I've got to say, I said this last night, and some of you know it already, but I'm the chair of the Oversight Subcommittee of the Energy and Commerce Committee. We have oversight over all the public health agencies, so the Centers for Disease Control and all the other ones. And what keeps me up at night, and now it's apparently for good reason that we see, is the idea of a pandemic. And in fact, I just had a hearing in my committee on December 4th before this all hit about the threat of the pandemic flu. And so I've frankly been dismayed, and this is not intended to be a partisan statement because I think partisanship is the last thing we need at this moment. But I've been dismayed about how there seems to have been a real delay in the testing, and we're seeing this in Colorado right now. What happened was the FDA and the CDC decided to develop their own coronavirus test in January, but the original test was contaminated in the lab. So then they had to do another one. They finally started sending it out about a week or two ago, but then they found out that the state labs, like the Colorado Health Department, didn't have enough bandwidth to really process the labs, and the other problem, or the test, and the other problem was that they didn't have enough of the reagents to be able to do it. So they're sorting that all out now, but I feel like they're about 3 or 4 weeks behind the curve. And at the same time now, and I'd be interested, Mayor, to hear from you and some of your folks if you're having any of these problems at the hospitals in Englewood. But I just got a list from Mayor Hancock about all of the personal protective equipment and other equipment that they urgently need in Denver. And what I'm really worried about is I'm really worried that we don't have, and you're reading about this, masks, respirators, other kinds of items that we need in the national stockpile. So now that we seem to be getting the tests in order, now that's the next thing we're focusing on, is how can we quickly ramp up production of some of these other items, because like if you don't have respirators in the hospital, people will die, and unnecessarily so. So all of this sort of trying to play catch up is what has led to Governor Polis and Mayor Hancock. Mayor Olson, I'd be interested to know what you're doing in Englewood, but people putting pretty stringent requirements on restaurants and bars and public gatherings of over 50, because with the spread, with the rapid community spread of this virus, if we don't flatten the curve, then our hospitals and our medical centers are all going to be inundated, and we're going to really have a healthcare crisis. So that's the hope right now. We've gone beyond, control and trace, and now we've gone to where we're just trying to basically flatten the curve. So that's sort of what's going on. You all know what the governor has said, and I'd be curious to know what you're doing in Englewood. Let me just talk very briefly about the 2 supplemental funding packages that Congress has passed to date. The first one was the package that we did very early in March. And as you'll recall, the president asked for $2.5 billion. Congress appropriated $8.3 billion in emergency funding, and the president signed it. This money is to go to begin to, it's by no means intended to be more than a very, very cursory first step. It's designed to really help ramp up the response. So it's got money for the Food and Drug Administration to try to develop vaccines, money for the Centers for Disease Control to try to work with state and local governments to help public health activities, money for vaccines, money for preparedness, nearly $1 billion for medical supplies. And so that's what that bill did. Then as you probably read, this past Saturday at 12:30 a.m., the House passed a second bill, the Family's First Coronavirus Response Act. What that was done was designed to really begin to help strengthen our communities. So the first thing that was in that bill, which I was very proud of because it was a bill that I had introduced earlier in the week, to require that any testing that had to be done would be free for the patients. So if someone needs diagnostic testing, then it'll be free. The second thing was food assistance under WIC, additional food assistance under WIC, under emergency food assistance, senior nutrition program, SNAP, all of those things. an expansion of Medicaid, $1 billion in expansion for unemployment, and then probably all read about this, 12 weeks of job protected leave under the Family and Medical Leave Act. That's the bill that we passed early Saturday morning, and it's been in the Senate. I just got notified by my staff. One lone member, Louis Gomer from Texas, was objecting to the technical corrections to that bill, and so it was held up most of the day yesterday in the House. But he was pressured by his leadership to withdraw those objections. So now the bill's gone to the Senate. We expect the Senate will pass it today, and it can get to the president's desk by the end of the week. We're now beginning to work on a third bill, and this bill will be a much broader bill. And what it'll involve is actual assistance for small businesses, we're going to try to figure out a way to have assistance for independent contractors and individual workers to try to really help stabilize folks for the next couple of months while we get through this. So that's sort of what's going on from my standpoint. Just another footnote, another issue that we've had come up in the past couple of days in my office is we've had a number of American citizens, school groups, Peace Corps volunteers, and others who are sort of stuck in these foreign countries who are trying to get home. And we've had some real difficulty in coordinating and communicating with the State Department. So we're working on that too. So that's what's going on from my end. Linda, why don't you tell me what you guys are doing?
So I've asked our manager, Sean Lewis, to outline everything that we've done. We're also in a very strange place as a council right now, which maybe, Sean, you can explain that too. We're a weak mayor system. It makes it very difficult for us to do some things as a council. So I'm going to let him sort of tell you what he's been doing so far with staff and the buildings and everything else, and then we can talk about the other item too.
Sure. Thank you, Mayor, and welcome, Congresswoman DeGette. We're honored to have you visiting.
Sean, I lost you. Oh, there you are. No.
Oh, can you hear me now?
Yes, I surely can.
Okay, sorry about that.
Okay.
As early as last week, we began taking some precautions, shutting down first our senior recreation center, feeling that was a high priority need. About the same time, the governor was declaring a state of emergency. I declared an administrative 7-day state of emergency and then shut down our recreation center as well as our library. And then over the weekend, we made some adjustments to the city council meeting scheduled for last night and made sure we could get an emergency declaration that would be permanent until rescinded. And unfortunately, we didn't get a quorum of city council last night. So we're going to have an emergency meeting tonight with council to make sure we have that prolonged and more robust emergency declaration so that our businesses can have access to federal and state funds if needed, and so that we can have the continued closure and widespread closure of city facilities to the public. So we've been working very closely with Tri-County Health as well as the Arapahoe County Office of Emergency Management, which is our emergency management service provider, and have been getting pretty good information there. And just, I want to thank the federal government and the CDC for their leadership, and we stand ready to help as needed.
Sean, have you been needed to tap into any of those resources yet? The federal resources?
Right now, what we're doing is our Economic Development Office is preparing kind of a summary of those to roll out along with our Chamber of Commerce, as well as just our own databases of our business community. And so that's what we're really focused on now. In terms of the city itself, no, we have not. We've only kind of been watching what the plan is, but I think the kind of city and government resources are a little bit less known at this time.
Okay. Well,
Congresswoman,
as you move forward, there is funding available through lots of different sources if cities need it for an emergency. So just work through Joe in my office if you need some help accessing that.
Great, thank you.
Congresswoman, if we can, I think I had some contact with Swedish last week, and they were just in the process, well, more than in the process. They were really working on some things to get everything ready for what they may get. I don't know what they've seen so far, so we'll try and contact them today to see what their issues are, if any, that we might help with. So in order to access those resources that you're talking about, can you resend us the contact information to Sean and I, make sure we know exactly who we're talking to about what?
Yeah, Joe, can you connect in with Sean?
Absolutely.
Great.
Thank you.
We did give masks. We did give masks out to those who came to the city council last night, so that if we did have to have a meeting, we would have those. But I think the testing issue is one that we're concerned about. We have a council member who is self-quarantining but can't get a test. And it's frustrating when we don't know for sure if we need to have him quarantined. If he doesn't need to be, we could have had a quorum.
Wow. Well, so that's, this is one thing that we're trying to deal with Congress as well. I think we've got 12 people who are quarantined right now, but what we're trying to figure out, you probably don't allow for electronic voting or for quorum, and neither does Congress. And I think for good reason. You want people to show up in times that aren't times of crisis. But what we're worried about now, if we do this third package, that all of us are going to have to get on airplanes and fly across the country to do it in a time when people are supposed to be self-isolating. So I mean, some of the government continuity issues are really important issues, and those go all the way from local government up to the federal government.
Well,
basically,
interrupt here for a second. I think I'm going to be really honest with you. That's what our issue is. We are trying to vote that we can actually make decisions electronically. And I do believe that we should be doing this. It's a whole new world we're in. There are ways to record it, make sure that everybody is and there's ways to allow the public actually to watch it. I think this is crazy to not be able to do this. And what it does is it keeps us from actually having any decisions out in the open, because everybody's making them by phone tag and behind closed doors, and nobody knows what's going on, and that it's not clear to anyone. So that is one of the things we're taking up tonight.
Especially in the time of an emergency. I mean, and this is the point some of us have made in Congress as well, is if it's an emergency, under a normal situation, you do want the members to, you want the members to be on the floor, you want them to be debating, you want to see that. But
Exactly.
In an emergency situation, you need to have some kind of a backup. And, they're seeing that on the political end right now, but with both the Democratic and Republican parties, with that bill that the legislature had to pass last week, saying that they could conduct the assemblies by electronic means, because otherwise nobody would come. And now let me say, with respect to the testing and the quarantining, I know it's been very, I will say, because I've worked on these public health issues for so many years, I know, like I talk with Dr. Fauci on a regular basis, and one of the two people in the first congressional district who tested positive, this was just 2 weeks ago, his wife called me, and so she's been giving me updates, and so I knew about this testing issue 2 weeks ago, and I called the senior officials, and it was very frustrating to me, because what they kept saying, well, we're sending 1.5 million kits out this week. We're sending 1.5 million kits, but that's really irrelevant if you don't have the bandwidth to be able to do the testing. And that's what's happening right now in Colorado. Is the Colorado, up until the end of last week, the Colorado Health Department only had the ability to process 60 test kits a day. So even if you had 1 million, it doesn't matter if you can't process them. And that's what has been, and then the second problem is the worried well, because what you had is then people who maybe had a cold or even the seasonal flu showing up at the emergency room and flooding the emergency rooms. So I'm hoping now, and I've got a phone call with the governor in a little while, but it seems to be day to day. And as of yesterday, we had, number one, we had Quest and LabCorp, two of the private labs, had opened up their system for testing, which should allow for many more tests a day. And then number two, CU and Denver Health have opened up their labs. So we're having private labs, and we're having some of the other universities and institutions who have labs. So I think the number has gone up dramatically since then. But like this same lady I talked about at the beginning, whose husband was one of the first two cases, now he's, it's been 2 weeks. So he wants to know, is he virus free? And they did a test on him, but he couldn't get the test results for days and days. So he was still quarantined, even though he was probably all right. And this is happening, people are getting tests, but then they can't get the results. And it's very frustrating. And what's more dangerous, it seems to have led to much more community spread because people just couldn't get tested. So it is what it is. What we have to do is we just have to go forward, and we have to just keep the pressure on to get all the testing that we need and to get those results back to people.
Sounds good. Are you willing to take questions?
Absolutely. That was my next suggestion.
I think just my general one is, I think everyone has clear angst about how this is going to impact our local businesses. I mean, we all think about the special places we go in our own little city and what kind of difficulties this is having for them. I know what you're passing. I just am not sure it's going to be enough to make it all work. Are there any ideas that you think that we could be pursuing to make sure that we keep people afloat?
Well, so with the small businesses, number one, they've increased unemployment aid for people, but then with the small businesses, they're working on a package of loans for small businesses, and they're also working on a package of it's small. The initial aid package had small business disaster loans, which was $1 billion in loan subsidies, and that was for small businesses, small agricultural cooperatives, aquaculture producers, nonprofits. One of the ladies on my call last night was running a nonprofit. She was very concerned. We're going to have to do a lot more with small business loans. And also what we're going to have to do is we're going to have to suspend. I think what we're going to have to do is if people already have loans, we're going to have to suspend their payments for a period of time, and that should help. But we're also going to have to put a much larger amount of money in the magnitude of billions of dollars into these small business loans for the small businesses, and then for the individuals. One bill I signed on to, and we're hoping it's going to be in the next package, is a bill that it's called the Emergency Money to the People Act. And what this is it would use the Earned Income Tax Credit to actually give out $1,000 at least to every American that earns less than $100,000, which is 2/3 of Americans. And I realize $1,000, that's not a huge amount, but at least it could help people make a rent payment or something else. And we're going to have much larger packages to help people be able to pay their bills. Now, I saw this morning in the paper, you may have seen this too. In Denver, and I don't know if you're doing it in Englewood. In Denver, they said they're not going to evict people. They're not going to enforce eviction notices, and then all of the utility companies, Denver Water and Excel and the other companies, have said they're not going to turn off people's utilities. So we're going to need to have more of that.
This is Sean Lewis, City Manager. We have discontinued red tag utilities as well as shutoffs for this period.
Yeah. So, I mean, this is, I was saying last night, I've been in Congress. I've seen pretty much everything. I saw the September 11th. I saw the near collapse of the economy in 2008. I've seen anthrax and MERS and SARS and Ebola, and this is frankly the worst crisis that I've seen. But I do think that all of these crises in the last 20 years have really helped us to be able to know at least where we're going to need to go and what we're going to do. And if we can, I don't know if you saw some of the news out of China this morning, not that we want to take the same draconian measures as China, but we may have to really, we may have to isolate people more for a month or two. But I think there was only one new case coming out of China or something today. So what we have to and at the same time, and we've totally lost track of this in the last few weeks. At the same time, we have we're trying to develop retrovirals and also a vaccine. Now the vaccine, it won't be on board for probably 18 months. But if we could at least get some kind of retroviral that would help, sort of like Tamiflu is with the flu, if we could get something like that, then we could really reduce the severe cases and the mortality.
Congresswoman, I think maybe Member Cuesta has a question. I'm not sure.
Sure.
Member Cuesta, do you have a question?
I do not at this time, but thank you for the information thus far.
Oh,
Okay.
you're unmuted, so I thought maybe you unmuted yourself for us. Sorry. Okay.
Mayor,
Anybody
I do have
else?
some questions, if that's all right.
Go ahead.
So you said there's $1 billion in aid going to small businesses, and according to the most recent Census Bureau statistics, there's 32,500,000 small businesses in the United States, which means that $1 billion is going to get about $30 to each small business. So I'm just curious as to what the criteria is under which we're going to be giving that aid in the form of loans to these small businesses, because clearly there's not enough to do much for all of them. Do you know what the criteria is that they're going to be using for awarding that?
It was basically disaster loans where people could apply to the Small Business Association for loans that would carry them over. But as I pointed out, this was just in our very first package that we did in the early days for the initial crisis. We're going to have to do another package probably next week that's going to be at levels of magnitude way above that. And it's taken a while for that to sink in, particularly to the administration. But I think they now realize $1 billion, as you so articulately say, that's not going to get very far. We're going to have to do much, much more than that, and we know it.
Okay.
And
then
it
regarding,
it seems like based on what the president was saying yesterday, he's beginning to realize that now too. So.
Gotcha. And you had mentioned something about suspension of loan payments. I'm interested in suspension of mortgages and rents for homeowners and renters as well. Is there anything at the federal level that could be done for that?
So I was, as I said, I think I was on a conference call with Speaker Pelosi and the Democratic caucus yesterday, and part of what we were talking about is the parameters of this next aid package. And this is one of the things that I'm not on the Ways and Means Committee, but this is one of the proposals the Ways and Means Committee is looking at, how we could help renters and also mortgages for the next few months, how we could help do a suspension on that. So, you have to figure out, are you going to suspend payment on the mortgages, or are you going to give people something like the earned income tax credit at the front end so they can pay the mortgages? And that's what the experts but we want to make sure that we keep our economy as stable as we can throughout this. And actually, I believe, I mean, this is surely a big crisis, but I believe that we have systems in place. So even though the stock market has fallen and so on, if we can contain the spread of the virus and flatten the curve, then I think we can rebuild our economy certainly more quickly after we did in 2008. Because in 2008, the mortgage, the home mortgages, the whole system, the banking system was really flawed, and we passed a lot of legislation to assure we wouldn't have some of those kinds of financial disasters. So I hope I'm right, but I fear I could be wrong. But this is what they'll try to figure out what to do.
Okay, and then I'm curious about food assistance for low-income families. You had mentioned WIC, seniors, and SNAP, but there's plenty of families who are going to be pretty soon entering the low-income status because of, reduced hours at work, not being able to live off of not being able to live off of their normally tipped wages, because restaurants and businesses where employees that earn tipped wages are not going to be able to go to work. And so I'm just curious as to what we can do at the federal level to try and provide some additional assistance. I know you had mentioned in expanding unemployment, but
yeah.
I'm worried about those, especially those tipped wage earners, because in the state of Colorado they're making like $7 an hour or something crazy like that, right?
Right.
And so, yeah, go ahead. I'm sorry.
Oh no, what I was going to say, and so many of them, the tip earners, are working at the restaurants and bars, which have now been ordered to be closed. So we're going to have to find some emergency assistance to go to those people. And part of that, again, getting back to the earned income tax credit, getting back to actually just giving folks. You know who else said this yesterday? Interestingly, is Mitt Romney. Is give everybody $1,000. Now that's not that much, but if you're earning tips, then it might be enough to help you pay your mortgage. Also, there's money in our initial bill, which we're going to have more, going to the emergency food assistance program to get more money in the local food banks. If kids have, if your citizens have kids, all the kids are off of school, so we've put more money into the school food programs to help the schools be able to give breakfast and lunch to low-income folks. So to me, what we should really focus our efforts on is this safety net. And the safety net, I think, expands. It's not just low-income people; it's middle-income people too, right? I mean, like the guy who was on my call last night, who's an independent worker, and his income is basically zero now. So he may not be low income in a normal situation, but he's about to be thrown into the low income category pronto. So those are the folks that we're really worrying about, as well as the low income.
So one of my concerns is you keep talking about this $1,000 amount, and I'll just be frank with you, that doesn't even cover 1 month of rent for me, and I'm not what I would consider a low income earner, but like you said, it would be difficult for me to not only pay my rent if rents are not suspended, but also be able to afford food and all of my other bills at the same time without work for an entire month. And I think as of right now, the way that things seem to be going, and as you mentioned, the administration didn't respond to this as quickly as they probably should have. Each day that we have, delayed taking real action on this crisis has added possibly multiple days, if not weeks, to the duration that this is going to last. So I'm really concerned about instituting a program that's going to give us effectively, $1,000 to each individual to try and compensate for, incomes that in order to live in the Denver metro area, you need to be making about $21 an hour to live on your own, and about $18 per hour to share a place with roommates. So with that being said, how can we further expand unemployment beyond giving $1,000 to each person, and how can we make sure that people are not being basically exploited and having wealth extracted from them during this crisis through rents, through usury tax or usury fees like loans? Are these business loans interest-free that you've been talking about, the $1 billion, and will the loans going forward be interest-free as well? And then, what other assistance can we provide to individuals to ensure that when their employer decides to shut down their business because of a lack of customers or whatever the case may be, that they're not going to end up homeless and increase our already sizable homeless population here in Colorado?
Right. Well, I mean, these are all really important points that you're making, and these are all the points that we're thinking about. I agree. I am not saying that giving people $1,000 solves the problem, but I'm saying that it's an initial way to help people right now. But it has to be combined with many other aspects, and these aspects have to be things that can be that can apply to many, like small businesses need to be able to get these loans, but they need to be able to figure out what to do with their workers. The workers, I mean, there's a lot of different facets, and we're working on all that. We know that these are the issues and that it's a crisis. So this is what we're trying to put together in this very large next bill. But everything you say, I agree with. So we just need to work it through.
Congresswoman DeGette, this is Nathaniel. I'm sorry. Are you done, Member Stone?
No, I was just gonna. It's Mayor. I was just gonna say, who else would like to say something? Go for it, Mayor Pro Tem.
Yeah, that was all I had, anyways. Thank you.
All right. No, I appreciate all the questions that you brought up, Member Stone. Especially around tip wages. I was curious about that as well.
Yeah.
So I guess I do have a question, and I'm sorry if this was already answered. I did step away for a quick second, but you mentioned about the tax credit, about potentially providing a tax credit. So how would that work? Does that mean that we're stating that at tax time, whether it's for the 2019 tax year or the 2020, is that when they would receive the tax credit payment? So is it basically deferred? Is it something that they wouldn't receive right away? I was just a little bit confused by that. Could you explain a little bit about how the tax credit would work and when people receive those dollars?
Yeah, so we already have earned income tax credit for low income folks, and it actually works because what it does is it gives cash to people right now rather than having to wait till next year after they file their tax return and so on. And so what it does is it provides an additional earned income tax credit to everybody who already gets it based on their 2019 tax returns, at least doubles their 2020, and then for everybody else who makes $100,000 or less, they would automatically get another $1,000. And so the way that works is they would immediately get half that money, and then the rest would come out over a couple of months, and they can apply for it immediately. So they get cash immediately, and that's the way that works. Like I say, I know that's not the full solution, but it's there's so 2/3, as I said, 2/3 of Americans make under $100,000.
Is now exiting.
So 2/3 of Americans make under $100,000 a year. So trying to think of a way where you can give those lower income and middle income Americans some cash now to be able to pay their needs is difficult to figure out how to do. And so this is a first step towards that, but it would also have to be combined with a lot of the other things that we've talked about this morning. And And so that's what we're trying to work out. What do we need to do to keep Americans in their homes, to keep them able to have food and utilities, and to to tide those small businesses over until they can reopen, we hope in a month or 2 months. And so that's what we're trying to do right now. And that's the story.
Right. No, I appreciate the answer. I just try to get a little bit of clarity on what the process was, and obviously it's still
Unknown
flux and
participant is now joining.
very complex situation.
Yeah.
I guess I had another question, but I guess it's more at the state level, and maybe it was really around the homeless. I'm sorry.
Oh yeah. Okay. So someone asked about the homeless last night too, and the main job of the federal government is to help give assistance to state and city governments to help the homeless. And we are at least the Democratic caucus in Congress is very, very focused on aid for the homeless. When I talk to the governor in a little while and also the mayor, I'm going to try to see what they need in terms of federal aid. But this really is a crisis because, as you could easily see, this COVID-19 virus could just spread like wildfire through the homeless population. We're going to need to find ways to help them, number one, be safe right now, and number two, to treat them if they get it, because this is a crisis, and we're working on that too.
Right. And I was just going to state, obviously since you're back at home here in Colorado, we're expecting a snowstorm here on Wednesday night to Thursday. So,
I saw that.
and just the fact that we're not, the guidance is to minimize the amount of crowds. And so where the homeless are going to go on cold nights, I think Member Anderson, maybe you're a little bit closer to that if you have anything to add, but that's something that concerns me, obviously, amongst many other things. So I appreciate your time. Thank you so much.
Yeah.
Yeah, this is Member Anderson. I'd weigh in on the homeless issue. I know I've been in touch with the Severe Weather Shelter Network, and their volunteers, many of them have stepped out. They don't have the capacity to offer. They were kind of hoping we wouldn't get a lot more severe weather this season, so I don't really know what the solution there is. Hopefully they have been able to pull together enough volunteers to offer the emergency sheltering, but right now that's a real tight spot.
Yeah. Okay, that's good information for me to have. I mean, actually, up until just the past few weeks, I've really been, and this is one of the things I wanted to talk to back when days were normal. I wanted to talk to you folks about, because homelessness is a reaching a crisis level in the whole metro area. And I've been talking to all of my city governments about homelessness and what I can help do at the federal level. As soon as life gets a little bit back to normal, I want to have some conversations with you all about long-term issues in the Front Range and ways that I can help you from the federal perspective. So aside from the immediate crisis, let's put that on our agenda for going forward.
Thank you for bringing that up. This is Mayor Olson. We have a Tri-Cities task force or policy group that's working on it. So I haven't had a conversation with you in a year to tell you where we are with that. I think we're in a really important place for us to be able to do something pretty significant in 6 months. So I'm hoping I'll send you some things via your contact to give you some update.
Yeah.
Because it's going to be regional. It has to be regional.
It has to be regional. And I had a really good meeting a couple of weeks ago with the Sheridan city government. I know they're working with you and Greenwood Village and others on this. And so I'll be delighted to talk to you. I'm glad you guys are really focusing on that. Let me just give you a news update in case you haven't heard. Chuck Schumer announced this morning that he wants to spend at least $750 billion on this third level that I'm talking about. And what the third level would talk about is
unknown participant is now exiting.
Is a lot of the issues that I've been mentioning this morning. So you can see we've just in a few weeks, we've ramped up from $8.3 billion to $750 billion. We know this is a crisis that we're going to have to address.
It's unprecedented. I know the president is on, I think, with some kind of a debriefing right now. I saw news come up. I did want to ask you, first of all, are there any other members that want to ask Congresswoman a question? I haven't
I
Okay.
have a question.
Go ahead.
Okay.
This is Member Cheryl Wink, Congresswoman.
Hi, Cheryl.
Hello. I was on your town hall last night. I spoke with Thomas last week on through the NLC conference, and I asked him
Unknown
about
participant is now joining.
that are obviously in the back seat right now. Regarding coronavirus, I'm curious to know what maybe the conversation or the environment is around governors more rapidly issuing orders to lock down, or maybe it's a mayor or a level, but to lock down cities. It feels like it's coming a little slowly. I know San Francisco has done so, but because people aren't really adhering to social distancing and just continuing to spread because they think they're healthy, because they're asymptomatic, they have no symptoms, they think everything's fine. Is there any sort of dialogue around just enforcing the lockdowns?
Well, so as I said last night on the town hall, I think in the United States it would be two things. I think that the White House has been slow to recognize the severity of this problem, and that's why governors have had to step in. Obviously, Washington State had some of them had those horrible nursing home spreads and deaths, and Governor Inslee had to really step in very quickly. But I think a lot of the governors, including our governor, have been really aggressive in trying to look around the corners and see where we wanted to go with this virus. We still have, I think that the virus is now in almost every state, but in rural areas, some of the other areas, some of the restrictions may not be necessary. And so far, the governors and the mayors really have taken the lead in seeing what their communities needed and locking down. I think that one of the reasons why in many of our states and cities we've had to do that is what you said. It's because a lot of people just didn't recognize how the severity of this problem quickly enough. And they still don't. And so I think that if people are not going to do it on their own, then we're going to have, particularly in urban areas like the Front Range, we're going to have consistent rules of closing bars, closing restaurants,
Right.
banning gatherings of more than even 10 people, and people are going to have to force to be complying with this for the community good. This is something America hasn't really had to do ever. Since
Correct.
Actually in 102 years since the 1918 flu pandemic.
I feel as if that's another difficulty for people to recognize what's really on our hands, because this is a once in a lifetime occurrence, and it's just that level of severe and people just don't recognize it. And I think at the point when some of them are going to recognize it is when, death is just upon us in maybe a more severe way than Italy. So that's unfortunate. I do have one more question, if you don't mind, Mayor. It's a little bit quicker question.
Okay, and then I do have a question.
Perfect. Thank you so much, Congresswoman. So, grocery stores, law enforcement. So the personnel stores like groceries and our law enforcement, they're in the foreseeable future still going to work and providing us that essential service. Has there been discussion around just blanket testing for those individuals just to maintain even if they're not symptomatic, because of the role they're in, and the few people that are going out for recognizing the essential needs, or the interacting with law enforcement? I mean, you could just be infecting these grocery store employees and law enforcement. It almost seems like it would be a little helpful. I know we're in dire need of tests, and tests only if you're exhibiting symptoms, etc. But I'm kind of concerned about that community.
Well, here's the problem that we have, and I actually asked this question of some of the leading doctors. And the problem is, until the virus reaches a certain level in your body, you're going to test negative. Sadly, you can be contagious even if you don't have symptoms, but just blanket testing whole groups of people is not going to give you very much of an answer, because they could be infected, but they could just not yet have enough of the virus in their system to be testing positive. So it would give you false confidence that your workforce was virus free, even if it, so what instead we need to do with groups of employees like this, healthcare employees, public service employees, essential services, we need to really need to model absolutely perfect public health behavior, the washing of the hands, the social distancing, not going to work if you're sick, calling your doctor, all of that. And if we do that, then even if somebody does become positive, then if people are having good hygiene habits, chances are less that they will get infected.
Okay, thank you very much.
I mean, in the healthcare profession, for example, in the early days, and even here in Colorado, because I talked to some healthcare providers, people who felt like they were getting sick were just showing up at the emergency room or at their doctor's office or at the neighborhood clinics, and some of them actually were positive, and then everybody who was in that environment was in quarantine. So you had whole doctor's office being quarantined for 2 weeks, just at the time that the virus started to grow. And so now we've got protocols in place. Don't show up at the emergency room. Don't show up at your doctor's office. Call, and they can send you to a testing outlet where you can be tested. And this is the kind of thing we're going to need to do. It's not perfect, but just blanket testing's not, someone last night asked me, had I been tested? And I said, I don't have any symptoms. And so it would be kind of useless to test me right now.
Sure. Thanks so much.
So
perfect.
All right, Mayor, I think you had a question.
I have one. Yes, I do. And this really is to be more proactive. What kinds of information do you need from us as one of your constituent cities that would help you in informing the people that you're trying to get to make joint decisions? We can funnel information your way, data that you need, whatever.
Yeah. So what if you hear of cases of transmission or whatever, let us know that. We're hearing a lot from our cities about what's going on. When you talk to Swedish, if they have to ask them what their stockpile looks like, are they doing okay? And then it really helps me from all of you if you just let us know what you're hearing from your small businesses and from your citizens about what they need going forward, because that's what helps us really inform us on the legislative solution that we put together. So if you can let us know all of that, that would be really helpful.
Okay, and that sounds good. A piece of info, and Member Stone is in this group, maybe others. There are some Facebook groups popping up that are intended to be networks to help one another. And so I think that's great to see that kind of good piece coming out. It would be helpful to have guidelines with some of that. I think people are being pretty wise, but just how people help others, because I can see us going up and down our blocks and asking people, what do you need? Who could go to the grocery store for you if you don't have someone, especially with our elderly population. We have a higher level of elderly in Englewood than a lot of the other cities around us.
Yeah, and
so
guidelines. And also on my website, we're putting up a whole area of my website dedicated to what do we know, what are the best protocols, and so on. But if you have elderly people or immunocompromised people, the best thing to advise them right now unequivocally is stay at home. And if they need help getting groceries or whatever, to let somebody know. But if people can just stay at home for now, that's what's going to help.
Okay, great. Manager Lewis or City Attorney, do either of you have any pressing issues you want to ask?
I was just going to say, as we are doing some work with our business community, would we just coordinate that information, sharing that information with Joe?
Absolutely.
Okay, will do.
Yeah. Okay. Thank you, everybody. We will
Thank you,
get through this
Congresswoman.
together. I really appreciate it. We'll do this again. I think this is really useful.
Thank you.
All
the
right. Take care.
Stay
Be
well.
safe, everybody. Okay.
Thank
you
you.
so
Bye-bye.
much.
Thank you.
Bye-bye.
Bye, everybody.
Multiple people are now exiting.
This
Multiple
is,
people are now exiting.
Congresswoman Diana DeGette.
Unknown participant is now exiting.